Good afternoon, everyone, and welcome to the online meeting to call for a fully staffed Community Neurorehabilitation Team for the Northwest. My name is Mags Rogers. I'm CEO with the Neurological Alliance of Ireland, the national umbrella of 40 neurological charities throughout Ireland that provide services and supports to people with neurological conditions and their families. I'm delighted to be joined today both by local people living with neurological conditions and by local voluntary service providers from across the Northwest. You are going to hear from them why it's vital that the 2019 promise to deliver a fully staffed neurorehabilitation team for the Northwest is delivered in this year's budget. The Northwest has a small existing community neurorehabilitation team, but it's only funded for a quarter of the posts that it should have. Teams in the South, West and East of Ireland that are coming on board into 2025 have been funded for 12 full-time equivalent posts. The Northwest team has only a fraction of that to serve a similar population to those other teams. The impact for people with neurological conditions throughout the Northwest is that people in Donegal, for example, face waiting times of more than 4 months to access the existing team, while there is no access to the existing team for people with neurological conditions throughout Sligo and Leitrim. A fully staffed team for the Northwest was originally promised in 2019, and there was also a commitment to expand that team in 2024, and both of those commitments still have not been delivered. Just a few quick housekeeping bits before we hear from our first speaker this afternoon. I'd like to ask everybody to wait until all the speakers have spoken, and then we'd be more than happy for people to join the meeting. I would like to welcome our elected representatives who have joined the meeting today. Just that if someone is from the office of a TD or senator, if they just want to enter into the chat who they're representing, just so we know everyone that is in attendance here today. Just to let you know that the meeting is recorded and will be available afterwards through our social media channels. I'm going to hand over now to our first speaker this afternoon, Rachel Hart from Ballysadare, and Rachel is going to talk about her experience of living with a neurological condition and the difference that having access to a community neurorehabilitation team would make to her. Hand over to you now, Rachel.
Good afternoon, everyone. My name is Rachel Scanlon. I'm 39 years old from Sligo, and I'm a mother of two, to Noah, aged 8, and Ruby, aged 6. My daughter Ruby has epilepsy, and she has had seizures since the age of 16 months. I've been a huge advocate for my daughter over the years. I have a good love for dance and drama, but in particular sport. And last year I was at the peak of my fitness with running and played local soccer. Having ran the Warriors Run in August, which is up a mountain, a challenging 15-kilometer run, I got a new PB there. And 3 weeks prior to sudden onset, I ran the Sligo Coast to Coast, which is a 10-mile run, getting another PB. So fitness was the peak last year until October 11th, when I was on the sideline due to an injury I picked up on that run. I was on the sideline of my soccer match and I got this horrendous headache. A headache like no other headache I've ever experienced. And I remember my friend telling me that she noticed that I didn't even engage with her. While driving home, I felt like this tingling in my face, and my headache was getting so much worse. And I felt my face was dropping and my mouth very out of sorts. When I arrived home, I said to my husband that I really didn't feel very well, and I dropped to the floor, taking seizures for over 40 minutes. While we waited on the ambulance, I remember thinking back, oh my goodness, am I going to make it? And all I could think of was my 2 children. So the ambulance arrived, took me to Sligo University Hospital, and there I also had multiple seizures. After many CT scans and other tests that were all coming back negative or clear, as I should say, I was admitted then to the neurology ward at Sligo Hospital. During this time, I was continuing to have seizures, headaches. I had right-sided weakness. My speech was very poor. My swallow was poor. I was basically paralyzed on my right side. And I needed one-to-one care for a number of weeks with feeding and care needs. And I was even in a wheelchair. During this time in Sligo Hospital, I had many tests like brain MRI, spinal MRI, heart echoes, EEG, and nothing was showing up. And it was quite scary for me and my family. But a couple of weeks later, I was informed that I have FND, which is functional neurological disorder. I'd never heard of it before. I hadn't ever even heard the word. Thankfully, my sister-in-law and my brother had done some research, and they found out about FND Ireland, which I'll go into in a couple of moments. But I suppose from the point of view of the care that I got at Sligo Hospital, I got access to OT and physio once I was able to sit up. But once that I got to that stage of sitting up, that them supports and those therapies were pulled back a bit. My daily struggles then were memory loss, fatigue, seizures, speech delays, pain and balance issues, and sensory issues. And on my fourth week, the doctors told me that I will need some rehab. Initially, I thought that my only option was Manorhamilton in Leitrim, but with a bit of research, we learned about Ben Bulben Rehab Unit in St. John's in Sligo. And I was accepted there simply because my symptoms were stroke-like symptoms, and that Ben Bulben ward particularly would have strokes patients. And I was transferred there after being 7 weeks in hospital, and I spent 9 weeks further in rehab. And the therapies I received there, which were so important for me and my recovery, were OT, physio, speech and language. I had support from a social care worker for myself and my husband. And then to fast forward, at the end of January, there was a discharge meeting where I got to have some opportunities for questions and answers with my multidisciplinary team. And we spoke about the support I would get. I was going home. And for me, that was a very scary place. I was being cared for 16 weeks in hospital, and then I was being sent home. And although I was excited, the only support that my consultant could get was community physio. I didn't meet the criteria for counselling or psychology support, and I wouldn't get home help was the answer I got when we asked the team. And I think it's because of functional neurological disorder diagnosis. Following a follow-up then was I was told in 3 months they would see me in outpatients. So with the fight again, I had to push for a sooner 6-week follow-up. I then had to transition from my step-down facility to my home, and with that, I was lucky that I was getting my physio and looking forward to that starting at the end of February. However, that never transpired until April, and that was a challenge. I had some setbacks in that time, and including seizures and being back in hospital, and some changes to my leg and my foot, and to the need for me to have neurophysio. For me, I get standard physio in the community, and not neuro, not specialized area. And there's a huge need still for many supports that I need, like neurophysio, OT, speech and language, some neuropsychology, psychologist, physical and sensory, and like a PA or a home assistant. For me, I was lucky to have that step down facility. Others don't get that opportunity, and I had a good multidisciplinary team that got me back to a walking element. And although Donegal have a facility, Sligo Leitrim can't access that, and we need to access that access here in Sligo and Leitrim and the whole Northwest. But for me, I had to push to even get my physio, like nearly 3 months after leaving hospital. And just to kind of recap, my diagnosis is a huge financial burden on my family. My husband still has to work. I'm not working. My children were without their mum for 16 weeks, and I've come home, but my diagnosis hasn't changed, and my symptoms haven't changed, only that I'm now not confined to a bed or a wheelchair. And I'm actually, as I said, there's huge issues, sensory, and for example, my 8-year-old one day had to assist me with crossing the road and telling me how whether it was okay to cross. And for me to access my physio program in my local gym, I need an adult to take me there. Up to last week, I wasn't able to cross that road myself. So I just want to initiate that the need for a neuro team in the Northwest is so important. And thank you all for listening to my story.
Rachel, thank you so much for sharing your experience and your honesty and being such a clear communicator this afternoon. I really appreciate it. And I suppose you really highlighted that frustration. As you say, you can get some physiotherapy, but it's not specialist physiotherapy. You've had no access at all to psychological support. You had the service in Sligo Hospital, and just there is nothing outside the hospital gates for you in terms of access to therapies. And just to reiterate, I've just been popping in the chat there. There is a small existing team, Community Neurorehabilitation Team in Donegal, supposedly for the Northwest, but people from Sligo and Leitrim have no access to that team because of underfunding. For people in Donegal, they're waiting over 4 months. And I have to stress that for neurorehabilitation, a wait of 4 months is an impossible wait. These are people with acquired brain injury, with stroke, people deteriorating every day in the community. They need critical access to neurorehabilitation as soon as possible. So a 4-month wait is an endless wait for those individuals. It's just not feasible. I'm just going to hand over to Eamon now. Eamon is going to talk about the need for a community neurorehabilitation team in the Northwest and his own experience of living with a neurological condition.
Thanks, Mags. So my name is Eamon McPartland. I live with 2 neurological conditions, dystonia and functional neurological disorder, FND, which is the same condition there that Rachel has. I'm the founder of FND Ireland, which is the first and only Irish charity dedicated to supporting those living with FND. At present, FND Ireland is headquartered in my hometown of Manorhamilton in Leitrim, and I'm also a lived experience representative on the board of the Neurological Alliance of Ireland. So I'm just going to tell you a little bit about my own story, how I got involved in advocacy, and as Rachel mentioned in Mags, the crucial importance of why we get a neurorehabilitation team in place to serve everyone in the Northwest. So I'm originally from outside Manorhamilton, but I spent much of my life living in Galway, where I worked as an engineer. My story is a little bit different to Rachel's in that my symptoms were not sudden onset. They appeared more gradually over time, which can happen with many progressive neurological conditions. I started having issues with my walk in my 30s, and I put these down to old sports injuries at the time. But my walk gradually got worse, and a few other symptoms got involved, including issues with my neck. I was probably at that stage in denial in my 30s to believe there was anything neurological wrong with me. But then unfortunately in my early 40s, my marriage broke down and pretty much things were rock bottom. So I said to myself, I have to find out what's going on. So I went back to my GP and he recommended a physiotherapist. Little did I know when I went to my physiotherapist or for that physio assessment that he was looking for signs of Parkinson's. My GP then said I didn't have typical Parkinson's, but he referred me to a neurologist who organised a brain and a neck scan. And I got a one-line letter back from my neurologist to confirm the scans were normal, and she was happy to share that. So I was no further on. So I just got on with life. It was a struggle, I'll be honest. There was many visits to physio, and by now I had to start taking time off work. And then one evening, a few months later, and this would have been at the end of 2016, the pulling of my head to one side really ramped up. So much so that night, my head actually was being constantly pushed into the pillow as I lay in bed. Now, I was never a person to Google, but I went online and I literally just searched head turn on its own because I really didn't know what to search. And I found a condition called dystonia. I was sure this was similar to what was happening with my neck and head, so I went to my GP and mentioned this. He had never heard of it and Googled himself when I was there. So he got me a referral to a neurologist in Dublin who specialised in dystonia. And within a few minutes of my assessment, I was diagnosed with cervical dystonia or neck dystonia. And obviously that was a big relief to have a diagnosis. But he also believed the problems with my walk were neurological and that I would need more tests. So I got admitted in the summer of 2017 to St Vincent's Hospital in Dublin for a series of tests and scans. And I got my first injections for my dystonia. Now I attend the dystonia clinic in Dublin every 3 months to get injections, which really help. But despite a series of tests, my problems with my walk could not be diagnosed, with the exception I had one of the Parkinson's genes. So move on to the end of 2018. I'd been out of work for over a year and the medical team wouldn't recommend I could return to work. So after nearly 25 years in Galway, I decided to return home to Leitrim to have family support close by. Now, returning home to Leitrim brought its own challenges, especially with being away from Leitrim for so long. It was hard when you met people you hadn't seen for years and they'd say, God, what happened to you anyway? You used to be so fit, Eamon. And to be honest, I got more conscious of my condition. At the time, I didn't want to talk about it. All I wanted was to find out what was causing it, to get an injection or a medication that would make it better. So I needed to get more physio, and obviously it wasn't practical to be travelling back to Galway for physio. So I remember getting an appointment with the HSE Community Physio Team in Manorhamilton, and the physio assessed me. And he said, I can't do anything for you. He said, you need neurophysiotherapy. So he gave me a name of a physio in Sligo Hospital. And he said, you need to get a neurologist to refer you there. So I was a wee bit frustrated, to say the least. But I got onto my neurologist, got the referral. And within a few months, I got 8 sessions with the neurophysiotherapist in Sligo Hospital. And they helped me to start using a treadmill to improve my walking. But the problem I want to share is that 5 years have passed and I've only got one set of physio sessions since. And that was by good fortune when a neurophysio from Sligo was temporary in Manorhamilton, because unfortunately there's not a single neurophysiotherapist in the community HSE service in Leitrim. So going back to what was causing my issues with walk, I was tried on a number of Parkinson's medications, but I was no further on, or the neurologist was no further on to figuring out what was causing the problems with my walk. So I got referred to a neurologist in London to the treatment abroad scheme. And I got to see him in the middle of 21, just after the COVID pandemic restrictions were being lifted. And he believes the problems with my walk were being caused by functional neurological disorder, FND. And I had the motor version, which affects movement. So just like Rachel, I'd never heard of FND. I'd assumed that FND must be very, very rare. And I was told there was no treatment for FND in Ireland. Now, I now know that FND is as common as MS, with an estimated 9,000 people living with the condition in Ireland. So at the end of 21, I got referred to a specialist FND neurorehabilitation program in London. But despite me switching to a virtual program following an assessment a year ago, I'm now 3.5 years on waiting to start the program in London. Now, I'm very fortunate to be on the waiting list because there's so many people in Ireland that won't even have a chance to get on that waiting list. In the meantime, I was also fortunate through the support of a benevolent fund to get a short 1-week private physio program in London 2 years ago. And that helped me to manage my symptoms better, but again, having a multidisciplinary team working with me for that week. Unfortunately, the historic view of FND has been that it's caused by a psychological trauma. And this resulted in my diagnosis being delayed because I had no psychological trauma that they could find in all the tests. And we now know that FND can be caused by many risk factors, including having another neurological condition or medical condition, or it could be an injury, or it could be genetics. So one important element that Rachel raised there is access to neuropsychology. And as she mentioned, just like myself, she could not get access to neuropsychology in Sligo or Leitrim. And the reason I raise this is that access to neuropsychology is important to not just those living with FND, but those living with all neurological conditions, because having a neurological condition is life-changing. And I've mentioned this many times. The challenges of living with a condition can actually be more difficult than the condition itself. So I am fortunate in a way to have my main neurology team based in St Vincent in Dublin. So I've got on the waiting list to see a neuropsychologist there, but I'm not waiting 2 years and I still haven't got that appointment. So the reality is, I probably would not be talking to you here today as a patient advocate, only for I took the first step myself to go to a peer support meeting at the Neurology Support Centre in Sligo some 4 years ago. I struggled greatly, like many people, with accepting my disability, and this acceptance only came about by sharing my experience with others in similar situations. As FND Ireland is a new charity run entirely by volunteers, we have extremely limited resources, but what drives me on to grow the organisation is my advocacy work for better services and the running of our peer support meetings and community connect events around the country, including the one we host in Leitrim and the one we hope to shortly host in Donegal. People with FND and their families are so grateful to have the opportunity to attend our meetings and know they're not alone. However, it's very difficult to tell people looking for support that not only do we not yet have a single FND clinic in the country, but where you live will determine whether you can access or can't access a community neurorehabilitation service. And I'll just give you a quick example of that postcode lottery. I met a lady from North Leitrim who lives with FND. She spent 4 months in Sligo University Hospital, tried to get access to the neurorehab team in Donegal, the small team that Mags mentioned, and even though her GP is in Donegal, she's just a 1 mile the wrong side of the Donegal border in Leitrim, which means no access to that team. Now, this lady, just like Rachel, fought to get support, and after a long struggle, got access to the National Rehabilitation Hospital. But everyone here knows how difficult it is to get access to the NRH. And this lady is the only person I'm aware of, through all the people I've met over the last year with FND, that's got access to the NRH that lives with FND. Until I founded FND Ireland, I never realised how many young people live with FND. And by living with FND, it means they can't continue in college. Some of them have to give up work in their 20s. Like, I look back myself and say, it impacted me in my 30s, 40s, but in your 20s, it must be so difficult. And all because they can't get access to any neurorehabilitation services in this country. So just to finish up, I hope both Rachel's and my own journey shines a light on the many difficulties faced by those living with FND in access and treatment, and those living with all neurological conditions. I ask all our Oireachtas members and councillors in the Northwest to support the Neurological Alliance of Ireland campaign to provide a fully staffed neurorehabilitation team to serve not just Donegal but also Sligo and Leitrim. I've campaigned on this issue for over 3 years now, and it's so frustrating, as Mags mentioned in the beginning, even though there was a commitment to fund this team in last year's HSE estimates, recruitment never proceeded. A fully staffed neuro rehab team in the Northwest providing multidisciplinary treatment, including physiotherapy, psychology, occupational therapy, speech and language therapy. It's vital for not just those of us living with FND, like myself and Rachel, but those living with any neurological conditions to give us a better quality of life. We can't wait any longer. The time has come. We need action, not promises. Thank you.
Eamon, thank you so much for that again, for sharing your experiences. And like that, as you say, this commitment has been made again and again to fully staff the Community Neurorehabilitation Team in the Northwest. I just popped there into the chat earlier on that the current team in Donegal is funded for less than 3 posts. There are teams for similar populations that have been established around the country this year, and they will have a team of 12. So there is a really significant inequity for people in the Northwest. I'm conscious we have a lot of people that want to join in the conversation. I want to thank again our elected representatives who are here to hear them. And so Eamon, you've spoken, and Rachel have spoken about functional neurological disorder. We have member organisations from across the Northwest today speaking on acquired brain injury, Huntington's, multiple sclerosis, muscular dystrophy, chronic pain. I'm going to bring a few of those into the conversation now just to share the services that they provide in the Northwest, and also the gap, not having a community neurorehabilitation team, the gap that represents for their patients, for patients living with their conditions. Catherine, I'm going to call on you in MS Ireland.
Thanks, Mags. Thanks, everyone. I'm delighted to be here to join this meeting and to acknowledge the hard work that the NAA or this campaign. It's a really important campaign, and I think hearing those 2 stories really bring it home. The personal effect that it has on individuals and their families. We in the Northwest provide services for people with MS, and we have access to the very limited neuro rehab team that's based in Balbafay. But as Mag says, it's only a very it's not even 4 full-time posts, well 3 full-time, but it's not even 3 full-time posts comparison to the 12 that other regions have. So really I think as Eamon said there, it's really just not good enough. And it's about time that, it was promised in 2019 that we would have a full complement of staff, and again last year, and it still hasn't happened. And in the meantime, people are, their condition is deteriorating, which obviously is going to have an extra cost on the health service going forward. So it really doesn't make sense for it not to happen, and to get the services and the supports that people need now and not waiting any longer than they have. And I'm delighted to see, as Eamon says, I'm delighted to see, and Rachel, that the amount of our public representatives and TDs that are on this meeting. So really, I suppose I'm again putting the pressure on them to make sure that this happens now and not to have to wait any longer. Thanks, Mags.
Thanks, Catherine. And I'm going to give the opportunity for those elected representatives to join the conversation in just a moment and just, give their own perspectives on the situation. Just before that, I just want to hear from a couple of other voices of NAI member organisations that are providing services in the Northwest. Una, if I could call on you in muscular dystrophy.
Yes, thank you very much. Yeah, I suppose similar issues are coming up for ourselves. I suppose just in relation to transport would be a huge issue. Most of our members would have to travel to the clinics in Dublin for to be seen by the consultants, and that in itself is a huge ordeal for a lot of our members, you know, in terms of leaving early in the morning, making the journey, attending clinics, and making the journey back. So yes, that would be quite a significant issue as well. I suppose just in general, just the lack of services. I mentioned transport, I mentioned just that journey. Yeah, so they would be two of the main things that would be coming up for us.
Thank you, Una, on behalf of people with muscular dystrophy living throughout the Northwest. I'll call on Christina in chronic pain. If you want to join, Christina.
Thank you, Mags. My name is Christina. As Mags said, I'm from Chronic Pain Ireland, and a lot of our members would also have a neurological condition. So the problem and the reality that they face is that they're in a fragmented system that does not treat them as a whole person. So they're often passed between specialists, from neurology to pain services to mental health, which often is a referral requiring them to return to their GP, and it can be years, not months. It's not just inefficient, it delays cares and it really worsens outcomes. A fully resourced community neurorehabilitation team will change that. These teams provide joined up patient-centred care, integrating neurology, pain management, physiotherapy, occupational therapy, neuropsychology and social work. And that's exactly the kind of interdisciplinary support that improves outcomes, prevents hospital readmissions, and it reduces long-term disability. And we know that this works. In the UK, it's been shown to reduce hospital stays up by 26%. Scandinavian countries, as Eamon has alluded to earlier, the younger age cohorts as well, earlier intervention can lead to significantly improved return to work rates and lower long-term care costs. Yet in the Northwest, the team is only a quarter funded, you know, so it's not just a funding issue. It's a question of fairness. It's a question of dignity and effective care. People living with complex conditions like chronic pain and neurological conditions and illnesses deserve better, and they deserve a system that works with them, not against them. Thank you, Mags.
Thank you, Christina. You make a really good, important point there just about the inequity. The teams that are funded, 12 staff in other areas of the country with a similar population, and the team in the Northwest funded for less than 3 staff full-time at the moment. I'm just conscious of letting our elected representatives come in to comment. I might just go to Aoife in Acquired Brain Injury Ireland, and then I'll let some of the elected representatives come in and join the conversation if they want to make a comment.
Thanks a million, Mags, and thanks to everybody attending today, deputies and representatives as well. In Acquired Brain Injury Ireland, we provide neurorehabilitation services in the community long-term for people who have survived an acquired brain injury by stroke, tumours or other traumatic incidents like road traffic collisions, falls, assaults, etc. And I suppose in the Northwest, we're currently able to provide limited community neurorehabilitation services to those who find our service or are referred into our service, either in a sort of an assisted living setup or in homes and communities themselves. And the problem that we have seen, I suppose, time and time again, is that because of the absence of a fully staffed CDNT, there are individuals living in the region who are not being diagnosed effectively with acquired brain injury, who are living with what we call this invisible disability, oftentimes symptoms that are going unrecognised and are falling between the cracks. We have people living 2, 3, 4, 5 years very often before finally they are referred into our service, at which point, with effective neurorehabilitation, they can go on to live very full, very independent and very meaningful lives. And we have seen many of them go from needing a very high degree of support to very low levels of support and returning out to be active citizens within their community, which is what neurorehabilitation for us is really all about. We know that is representative as, I suppose, a fragmented neurorehabilitation pathway that exists from acute hospital to home. The CDNTs are an absolutely critical point in that pathway. And we believe that if that CDNT was in place, fully staffed and available to people who have those acquired brain injuries at the beginning, then those individuals wouldn't be falling between the cracks. They would receive neurorehabilitation at the time that they need it, where their rehabilitation potential is at its fullest. And then they could be supported longer term into the community by other vital services like ourselves, who are working with them after the 12 weeks or so of community neurorehab team support as they transition back into their everyday lives. So we have ample stories to share of, you know, of those of those situations, those circumstances, and we know the relief that people feel when they finally get to meet somebody in our organisation and they know that they've been diagnosed, they feel understood. And I suppose we just know that for all of those out there who are still living in that gap, that the CDN or that the community neuro rehab.
I think we might have lost you there, Aoife. You're just kind of grand. Thank you so much, Aoife, for that and giving that perspective on behalf of people with acquired brain injury. And I say we have groups representing acquired brain injury, MS, Huntington's, chronic pain, muscular dystrophy, and a number of other conditions. But I'm conscious of time, and I just want to allow our elected representatives who are so kind to give their time to us this afternoon if they want to join at this stage and make any comment or observation on the stories that they've heard this afternoon. Deputy Doherty, I see your hand up there.
Yeah, thanks, Mags, and thanks to everybody who participated in sharing the importance of having this team fully staffed and fully funded and fully up and running as quickly as possible in the Northwest, and particular to Rachel and Eamon for sharing your own personal stories. I really appreciate that. Just look, I'm obviously we're fully committed in our party. We've committed to that in the manifestos, but the problem is there's been commitments from all parties and no delivery. So we're not going to go into that. But look, I'm not going to talk about the need for it, because we're all, I think, on this call for the reason that we accept that there is a need, that it's a disgrace in my view, and I'll hold back in terms of my language, but that patients are being treated in this way in the Northwest. But I really want to just focus in on just a couple of wee particulars that will help myself in continuing to raise this issue, and that's the fact that the three positions, so the three questions I have, if that's okay. There's 3 whole-time equivalents at the minute in the Northwest, and the rest is not funded. Okay, so I'm taking it a case that it's not a recruitment challenge here. This is a funding issue, and I just that's what I don't understand. Why is this not getting to the point where there's, you know, in a lot of cases it's not a funding issue, it's a recruitment issue. So is this just not making its way onto, like, this was on the service plan, it was committed to in 2019, it was on the service plan in 2014. If it's on the service plan, how is it still not funded? If you could focus in on that little bit, in my view. And then the other thing that would be helpful is, and I'm not asking maybe for now, but if it could be emailed in, if you have the information, of the other 9 positions, the 9 whole-time equivalent, what roles would they be providing in relation to the team that would also help? So, and look, from our point of view, and I know politics in the call here as well, but we will absolutely push this and pursue this. I know there's commitments in relation to a consultant locum being appointed as well, and we're following up in relation to that, whether that has actually happened as of yet, and clinical nurse specialists. So, but I would like to see those two elements from a funding point of view, and the 9, is there 9 key roles, or what are the roles that we're looking for and that make up the full team? And I believe that the NAI also are suggesting that the teams actually should be bigger than the 12. I think that's the case, is it? That should be also, and maybe if you could just speak to that, what is the additional capacity? I know if we had the 12, we'd be, you know, we'd be in a lot better space than we are now, but we also need to be making sure that we have the best service, and if it requires more than the 12, I'd like to hear from that as well. Thanks a million.
Thank you, Deputy Doherty. I'm just going to come in quickly with a response, but if there's any additional information that other people on the call have, or if they want to chip in, just in response to your, is this a funding issue or a recruitment issue? It's very much a funding issue. There has been no attempt to recruit the other to the 12. The team is not funded for the 12 whole-time equivalents. It is only funded, as I say, for less than 3 whole-time equivalents. And as you say, it was in the service plan yesterday, in 2024. It's a prioritization issue. It was just never funded. The funding never came through to enable the delivery of the 12. The commitment was in the service plan. It was not delivered. And we are aware of that. I will forward that information in relation to the other members of the team. So for example, Rachel spoke about the need for neuropsychology. That service is again, that is available in the team, but not to people in Sligo Leitrim. But services like a clinical nurse specialist, consultant role on that team, social worker, all of those posts that are available in the 12 staff, the teams of 12 that are being funded around the country this year in other areas of the country, they are not available within the Northwest team. So I will absolutely follow up in an email to you with the posts that are in fact missing on the Northwest team. Just on your comment on should the team be larger, there is a commitment in the action plan on disability services to have a team of 18. So the Community Neurorehabilitation Team by 2026 of that plan should have a team of 18. That is the end goal for those Community Neurorehabilitation Teams. But we're not off the starting blocks in the Northwest in terms of that minimum team of 12. And as I said at the start of the call, there are teams coming on board in Dublin, Kildare, West Wicklow, in the south and in the west of Ireland in 2025, that it will be fully funded for a team of 12 full-time equivalent. And the Northwest is struggling on for a population of similar size with a team of less than 3. I just want to bring anyone else who wants to, but I'll follow up on what posts are missing, what services they're not getting access to because of the size of that team. If any of our other Deputy McLaughlin, do you want to come in there?
Yeah, thanks very much for organising the meeting today. I mean, obviously the prerogative of the TDs, senators and councillors in Donegal and the Northwest is around equality of access to healthcare. This is bedevilled. I can only speak with authority about Donegal. It's bedevilled us across various sectors. We've had cancer care campaigners, diabetes care campaigners met with the minister very briefly last week. And I mean, if you look across the whole spectrum, unfortunately, our people do not get access to the same quality of healthcare as others, and that's, you know, it's just unacceptable. So I really appreciate the briefing. I would ask that now I have some of the posts that you're putting up on the Zoom call here, I'd copied and pasted them and sent them on to myself for notes. But if you could just send us, you know, if you were sitting in front of the minister, what are the asks? You know, now they are. I know I've got some of them there, but Pierce has touched on it. If we could get a briefing, and also invite your colleagues who are on the call from the various organisations, if they wish to send questions to you that you could forward on, maybe all of them. One of the few very good things about being a TD is we get to put parliamentary questions, and we must get an honest response from the relevant department within, you know, usually a week. With health services, it can take sort of 2 to 3 weeks, but we can get responses. And I'd like to make an open invitation. I know these meetings you'll do from time to time, but please feel free to send us parliamentary questions, draft parliamentary questions anytime you wish, so we can continue to get on the record responses on these issues. Just please stay in constant contact. It's very easy for us to send a parliamentary question, track it, and come back to you with a response. So, you know, let this be, you know, part of an ongoing dialogue today. Okay, thank you.
Thank you, Deputy McLaughlin. Just in terms of if we're sitting in front of the minister, we are calling for this team to be funded in the upcoming budget. The team in the Northwest to be funded. There is a commitment in the current programme for government to complete the rollout of this team of the Community Neurorehabilitation Teams. A direct commitment on page 94 the current programme for government to fund the remaining Community Neurorehabilitation Teams, and that includes the team in the Northwest. Thank you so much. Is there anyone else who wants to? I've a hand up there from Eamon.
Sorry, Mags, I just want to have one quick note there, just to what Deputy Doherty was saying, Deputy McLaughlin. Just to let you know, the reason, or part of the reason, that this team in the Northwest didn't proceed last year was a decision made at a steering group level to switch the focus to a new team in Dublin, rather than expand the team in the Northwest. Now, I'm very open. People know me in advocacy. I call a spade a spade. And it was very frustrated I'm involved in a number of working groups in that programme, and it took me ages to get answers what was happening with the team in the Northwest. Now, the double whammy was that the team in Dublin didn't get funding either. So it was a complete disaster. No team that was promised got funding in last year's budget. So we're now left with 4 locations without funding for teams. So in my role on the board of the Neurological Alliance of Ireland, I support teams in every corner of the country. But since I live in the Northwest and I agree with the deputies, I know from my experience of moving back to Leitrim from Galway a few years ago, it is so difficult to get services here. And recruitment can be a challenge, but there's no recruitment issue here. It's at the present, it's an issue of having the teams funded to go to recruitment.
So thanks so much for that clarity, Eamon, and you're absolutely right that it was a commitment that was made, it was in the service plan, and as you say, it popped back out again and hasn't been delivered. Councillor Meehan, I know you want to come in.
Thank you very much, and thank you very much for this briefing today. It's very, very useful to get an overview of everything that is happening and not happening. And it's fantastic to get input from Rachel and Eamon there from their own personal experiences. So thank you very much for sharing those. Look, at obviously kind of neurology in general in the Northwest is something that it's something that I have been interested in from previous campaigns. We work with, in my other job in the community sector, we work with an MS support group in Milford, and we have a very high concentration of people with MS in North Donegal. So it's something that is a priority to see proper services in place. But the information that's provided here today is vital for us to be able to kind of bring that to the next level. And anything that I can do through the Regional Health Forum, I'd be very willing to work with the Neurological Alliance of Ireland or any of the other groups in terms of raising questions or anything like that. So thank you very much.
Thank you so much, Councillor Meehan, and offering us that vehicle as well through the regional forum of getting this issue addressed. Maria, you want to come in there?
Yeah, thanks. I suppose I just want to reiterate a lot of it's been touched on right through everybody's talks and presentations. I think that what's really, really crucial here is the importance of intervention with the neuro rehab when somebody needs it, not 4 months down the line, 6 months down the line, because you've lost it. If you don't have somebody working with the problem from the get-go, there's going to be more problems down the line that may not be manageable or certainly reversible. So I think for that reason alone, it's important that we have somebody ASAP. I do think having the appointment of a neurologist in Letterkenny and hopefully a team to support him or her will strengthen this. But it shouldn't be a them or us. It's very much a coordinated approach. So it's important to just to recognize that that's some of the ways towards getting a proper team. Several mention has been made of the fact that we have 3 specialists here in Donegal. That's actually 2 and a bit, because there's the OT post is not a full-time post. The physiotherapy post in neuro rehab is full-time, and a full-time neuropsychologist. And again, they are so hard pressed with everything that they have throughout from all over the whole county. They can't do everything, and that just makes the whole scenario more chronic. So I really would appreciate anything that anyone can do to push this forward, and without any further delays. And I'm speaking, I suppose, from MS Ireland as well, just to say that. Thanks.
Thanks, Maria. And I think that point has to be made over and over again. Unfortunately, we've got too used to lengthy waiting lists in this country. So when I'm saying a waiting list of 4 months, people are shrugging. What is 4 months? Sure, it could be a year, it could be, but 4 months to a person with a neurological condition is life-changing. These are people with strokes, acquired brain injuries, multiple sclerosis, Parkinson's disease, a range of other neurological conditions. Early access to neurorehabilitation is vital to these people to get their lives back, to be able to live normal lives in their community. That waiting list, any waiting time is unacceptable. People really need access to neurorehabilitation as soon as possible. Jim, I think you want to come in there.
Just on behalf of Minister Harkin, unfortunately she couldn't be here today, but very simply just to thank you for the very clear presentation. To thank Eamon and Rachel specifically for sharing their own stories. It is something the Minister is really concerned about and has been for some time. So I'd like if you would send me all the information that you have to include, to send it to our office, and most certainly she will be taking it with her to meetings with the Minister, and it's something she will be pursuing. Okay, so thank you again for the invitation, and thanks for the presentation.
Thank you so much. As I say, we will be launching our pre-budget submission in June. We will be calling for the 4 remaining community neurorehabilitation teams in line with the commitment with the programme for government, and one of those will be a fully staffed community neurorehabilitation team for the Northwest. I'm very conscious of people's time. I just want to thank all of our speakers today, to Rachel and Eamon for their personal experience, and also to all of the service provider organisations that you've heard from. I know I haven't got to everybody. Unfortunately, time has run out for us. But I just want to say we will certainly be following up Deputy Doherty's very kind offer to email directly any questions to me, mrogers@nei.ie, to any questions that you want passed on, and we will be sending on the information that they've requested from the meeting today. So thank you all so much for joining us. And as I say, we will not go anywhere until we get this issue resolved on behalf of people with neurological conditions throughout the Northwest. Good afternoon.